Right, let's take you here now. There are now almost 995,149 confirmed COVID-19 cases on the African continent. South Africa has the most infections. It leads, followed by Egypt, Nigeria, Ghana and Algeria. The Africa Center for Disease Control is a specialized healthcare agency of the 55-member African Union. I'm joined by Director Dr. John Nkengasong to tell us more in terms of efforts to combat the virus on the continent and what it is that we individually can do. Dr. Nkengasong, thank you very much for joining us this afternoon. Perhaps let's start with the launch of the World Mask Week. What are we talking about?
Thank you for having me on your program. The World Mask Week is a week that recognizes the scientifically proven evidence that wearing masks constantly and appropriately can reduce transmission of the COVID-19 virus. I think that is a very important intervention. And we have to also put that in the context of the community, that wearing masks consistently and appropriately in a sustained manner has to be led at the community level. We need to get the community used to doing that. We have to enable the community to do that. A mask may cost a few cents, but it's a lot for certain community segments of our community. So I think that is what the World Mask Week is all about.
And let's move on to what we had seen before we got to this point. As we approach the 1 million infection mark on the continent, a lot of naysayers had said that by this time the African continent would be devastated by COVID-19, yet here we stand. How would you assess how we have fared so far?
I think we did very well in the very first phase of the COVID-19 pandemic, where we reacted quickly. The continent exercised very good leadership at multiple layers. At the level of the continent, that was spearheaded by President Ramaphosa in his capacity as the chair of the African Union. And then at country level, if you recall appropriately, by the end of the month of February and beginning March, where the first cases were beginning to be imported on the continent, many countries went into shutdown. Many countries declared a state of emergency and imposed very strict measures. That really helped. We have data and evidence to show that if we didn't do that, the pandemic would be at a very different level now for the continent. I think that helped. But as we move to phase 2, which is we'll begin to ease the lockdown, we are beginning to see, of course, a rapid increase in the economy, in the infections, I beg your pardon. So that, I mean, we have to also adjust our strategy accordingly. And that's why this week we'll be announcing a major initiative at the Africa CDC and the African Union Commission, which is entitled Saving Lives and Saving Saving Lives and Saving the Economy and Livelihoods, which is really underpinned by the need to protect our people's lives, the need to protect businesses and economy, and the need to protect schools as we open up schools.
Are you able to maybe just give us a few details ahead of that announcement, if you are able to, of course?
Absolutely. I think we started discussing this today at the regular press conference. We recognize that as you ease the lockdown, you see increase in number of cases, and we have to be ahead of the curve. So let me take the first goal of that, which is to protect our borders and to protect our travel. If you look across the continent, there's a need to harmonize our practice with respect to the COVID test. Some countries are requiring that you have a COVID test before you travel. Some are not. Some countries are requesting that the test should be at least 2 days before you travel. So the Africa CDC is stepping in to provide some guidance and to provide a direction on what we should actually be doing in a coordinated way and a harmonized way. I think that is key. The second thing we are trying to do, the second is protecting economies and businesses and livelihoods, is to say that we need technology that will enable us to work within each economic region and to work across different economic regions, like the SADC, and the East African Economic Bloc working together, but then a lot happening within the SADC itself, where you share information on movement of people, on movement of cases as much as possible. I think that is key. Then lastly is protecting our schools. Our schools will not remain locked down forever. We need to use science to begin to open schools progressively. But that should be backed with the ability to assess risks, to conduct a massive testing so that we understand what is happening in the communities. We should always remember that what happens in the school setting is a reflection of what is in the community. For example, if we test a community and realize that the infection rate there is 1%, then it tells us that we can safely open our schools. But contrary, if we test the community extensively and we see that the infection rate is 20%, it suggests to us that that is not a setting for us to open schools yet. So I think that is what this saving lives and saving livelihoods and economies is all about.
When we look at the rate of recoveries on the continent, yes, we are approaching the 1 million mark in terms of infections, but we're quite doing well on the recovery side. We're sitting at 675,415 recoveries on the continent. What do we put that down to as we're finding out more about how this virus works?
I think that is good news, absolutely, because as you rightly stated, we are the rate of recovery is around 68 to 70%, which is very good. I perhaps attribute that to the youthfulness of our population. As you all you recall, less than 70% of our population is about 30 years old. I think that is very important. I believe that that is helping us as a continent to record lower mortality rates. The overall mortality rate for the continent is about 2.2%, which compares, if you compare that to about 4%, which is the global case fatality rate, it means we are almost half of that. So I think that is good news. But we still need to conduct the appropriate science to understand who has been infected, how many people are asymptomatic, those who are, if you are infected, how many of those people are asymptomatic, and then those who are dying, the 21,000 people that have died, who are they and what are the risk factors that they are dying of. So there's a lot to be done to understand our pandemic as a continent, if you compare that to what we know as for the continent.
Right. Very quickly for us, Dr. Nkengasong, as we struggle with fragile healthcare systems on the continent, we're also bedeviled by allegations of corruption in some of our countries. What do you believe needs to be done?
What I believe needs to be done is that the COVID-19 has exposed the continent in a very, very significant way, has exposed the continent in terms of the weaknesses that we always knew that characterize our public health systems and our healthcare system as a whole. I think this is the time for us to, as we tackle this virus and hopefully defeat it, which we have to, we have a very good chance and opportunity of defeating this virus, because about 65% of our countries are reporting less than 5,000 cases, which is still a very good opportunity to do to implement good public health measures there. But what we are learning from this is that we need to scale up our public workforce as a whole, not just for COVID response, but as a whole. We need to strengthen our surveillance networks and laboratory networks as quickly as possible, and very importantly, to focus on local manufacturing. Local manufacturing of diagnostics and local manufacturing of drugs is critical. We cannot, as a continent of 1.3 billion people, continue to rely on externalities to influence and guide our health security for the continent. When we started this fight in January, there was absolutely no country on the continent that was able to produce diagnostics or had access to diagnostics to COVID. That has to change if we have to be a continent that is ready to fight the next pandemic. There should be no doubt there will be another pandemic, and we just don't know how the next pandemic will look like. It might be actually more virulent and more deadly than this virus, which means the time for us to strengthen our systems, health system, is now. We take advantage of the COVID crisis to build even better, to build even stronger health systems, what are called better, bigger, and bolder.
Absolutely. Thank you very much to the director of the Africa Center for Disease Control, that's Dr. John Nkengasong.